Hi, my name is Kayla. Today I'm going to be demonstrating on how to hang a Medibag. I am in Professor Lloyd's Adult Health 1 Term 2 class. Before I begin, I'm going to go ahead and implement standard protocol by looking at my MAR and my physician's documents to make sure that I've got the right patient, the correct medication that they want, and the route and dose. So before I go into my patient's room, I'm going to get all of my supplies ready. First, I'm going to go ahead and apply a blunt cannula to a 10 milliliter syringe and draw back 6 milliliters for when I need to flush my line. First, I'll aspirate it into there, and then we'll put the water in. Okay, and just recap that. So now I have 6 milliliters of normal saline to flush my line. Next, I'm going to go ahead and prime. First, I'm going to make sure I've got the right medicine. I've got 0.9 normal saline according to my MAR. I'm going to go ahead and label my bag. I'm going to label it with the date, the initials, the medication, the route, and the dose and frequency, and the time and the site. I'm also going to label my line with the patient's name, my initials, the date, the time, the medication, and the dose as well. So next I'm going to go ahead and prime my extension tubing. First I'm going to go ahead and prime this, just saying I would have wiped off the top of my bottle with an alcohol wipe before I got the normal saline out. Okay, so next I'm going to go ahead and have this upside down so that I don't have any leakage, making sure that all my tubes are locked and the cap is on. I'm going to go ahead and spike the bag. Being safe to not hurt anything. Okay, now that the bag is spiked, I will go ahead and let the tube out and unclamp it all the way to I'll unclamp it to make sure that the medication runs all the way through, making sure that there is no bubbles in the line. Making sure this is full so the medicine's pouring out, and then it'll go through the line. Alright, now that my medication is primed, I will take my medication. Before I leave anywhere, I'll make sure this is clamped. I'll take my gloves, my pen, my tubing and my medication, my saline, and alcohol swabs. And we'll move into the patient's room. Hi, my name is Kayla. I'm going to be your nurse today. Can you go ahead and tell me your name and your date of birth? Thank you. Now, do you have any allergies to saline or alcohol, latex, anything of that sort? Okay, good. Well, your doctor ordered for you to have normal saline today. Did he talk to you about that? Well, he said he wanted it just for hydration while you're in the hospital.
Then I'm going to attach the suction. Then I'm going to attach a low intermittent suction to the machine.
Okay. Well, first I'm going to go ahead and look at your IV site. I'm going to wash my hands before I touch it. Okay. So I'm going to make sure that there's no redness or swelling or edema. Make sure there's no tenderness. Okay, good. And now I'm going to go ahead and flush the sites. First, I'm going to take an alcohol swab. Before I use the alcohol swab, I'm going to go ahead and rewash my hands and place on my clean gloves. Now that I have my clean gloves on, I'm going to go ahead and take my alcohol swab and clean the port. I'm going to go ahead, and since this is a needleless port, I'm going to take off my blunt cannula and attach it to, I'm first going to aspirate, see that I see blood, and I'm going to go ahead and flush. I'm going to unclip it so that it won't flush. So now I'm going to aspirate and see blood and push that saline in there, making sure I don't see any blebs or inflammation or anything of that sort. Now I'm going to unclamp my syringe and take my tubing, making sure that it's clamped. I will take off my cap. And I will attach this to the tube. Okay, now I'm going to go ahead and set my...
But put your stethoscope, right?
No, I already pushed back.
Well, I don't see it push back.
Hi, I hope I didn't realize that.
Sorry. I did not.
Okay, I'm going to make sure that the clamp opens. Frying bag. 17 drops a minute and allow it to flow.
Put your stethoscope.
Okay.
You said left upper gastric area.
Now that it's dropping at 17 drops per minute, I'm going to go back and check my site to make sure that it is not swelling or tender, there's no edema or redness. And I'm going to go ahead and do my documentation. I'm going to document the site that I put the medication at, the type of medication, the dose and frequency, the date, the patient's name, my initials, and the INO.